Hey guys, this is Dr. Hub. Today we look at the American Society of Anesthesiologists. So in short, it is known as the ASA. And we are focusing on the physical status classification of the patient. The physical status classification of the patients. So this is known as the PS. So it is the ASA and the PS. Now to begin with, first we look at class 1. So under class 1, it includes, the definition is a normal healthy patient. So class 1 is nothing but a normal healthy patient. This is class 1. So what are the examples of this class 1? The examples is that it includes, there is a healthy, there is non-smoking, as well as no or minimal alcohol use. No or minimal alcohol use. So this was about class 1. Then we move on to class 2. So class 2 is nothing but a patient with mild systemic disease. So the patient has mild systemic disease. So what are the examples of class 2? So class 2 examples, it can include the current smoker, and a well-controlled DM, diabetes mellitus, as well as the STN, that is the hypertension. Next we move on to grade 3. So in class 3, there is a patient with severe systemic diseases, and the example here, it includes a poor controlled, so it is a poorly controlled DM. DM is nothing but the diabetes mellitus, then as well as the hypertension. Next, there is also history of greater than 3 months. So history greater than 3 months, and this is of what? And this includes the MI. Next is the CVA. Then comes the TIA, the CAD or stents. Now we'll move on to the grade 4. So grade 4 is a patient with severe systemic disease, and that is a constant threat to life. So it is a constant threat to life. Now we look at the example in case of type 4. So the type 4 can include examples such as, there is recent. So recent, by meaning we mean less than 3 months. This is MI. Next we have CVA, then TIA or CAD stents. Then we move on to the grade 5. So grade 5 is a moribund patient, and this patient is not expected to survive. So they are not expected to survive without operation. So without operation. So what we mean to tell is that only survival is possible with the operation. So this includes the examples. There are ruptured abdominal, then there is also the thoracic aneurysm. Then comes the massive trauma. So there is massive trauma, then intracranial bleed, and this is along with the mass effect. This is with the mass effect. Lastly, we'll move on to the grade 6. In grade 6, the definition is that a declared brain dead patient. It is a declared brain dead patient and whose organs are being removed for donor purposes. So their organs are removed, and this is for the donor purpose. For the donor purpose. So this was about the ASA PS, that is American Society of Anesthesiologists, physical status classification of the patients. To learn and grow daily like this, please do subscribe.